Hello everyone. This research was conducted by Adrian Koenig and Eduardo Silva, and it was based on the question, is COVID-19 increasing the intake of prescribed medication for mental health disorders in Canada? We all know that COVID-19 created an impact on the world medically, economically, and socially, with significant disruption to our lives and daily routines. This is why the Center of Addiction and Mental Health found that 50% of Canadians reported bad mental health since the pandemic began. But not only that, they also found that 48%, there's a 48% increase on anxiety and 38% increase on stress and 24% increase on depression and 25% in sadness. So there is an increment in prescribed drug medication as well. And also a survey from the University of British Columbia and the Canadian Mental Health Association found or identified an increase of use in prescribed medication. So as I mentioned, there's research that had identified the increase of prescription medication use in those with pre-existing mental health conditions. However, there's more information needed on the impact that COVID-19 is having on mental health and related medication consumption and expenditure. As with that saying, the aim of this study or survey is to answer the question, have restrictions due to the COVID-19 pandemic increased mental health issues and consequently increase the intake of central nervous system prescribed medication for mental health related disorders? So when we talk about central nervous system, prescribed medication are those used to treat anxiety, panic, stress, and sleep-related disorders. So to answer this question, we did an analysis of survey data from a sample population that was conducted pertaining to mental health impacts of COVID-19, specifically how the pandemic has affected the participants' mental health. The idea was to make a comparative survey that was focused on gaining information about mental health status before and during the COVID-19 pandemic. So this survey was created on a Google platform, and it was distributed through social media to Canadian residents. So it was created in February 2nd of 2021, and it was posted until March 29 of 2021. It was distributed online. It had through Facebook and WhatsApp. It had 19 quantitative questions and 1 qualitative question. There were in total 81 participants, and it had the main variables were mental health status, mental health symptoms, sleeping habits, and the experiences during COVID. Those were the main variables. A t-test was conducted also to determine the relationship between mental health symptoms before and during COVID-19. Margin of error for proportion derived from our sample of 81 participants is 1.52% at 95% level of confidence. So the survey included, as I said, 81 participants, and the demographics were they responded as being 29.6% male, 70.4% females. So the data was collected and downloaded and cleaned in Excel for analysis. So analysis of the data involved the descriptive and inferential statistics processes as well. So we can see a little bit more of the demographics. So the majority of age was between 35 to 54 years old. There was 28.7% of participants from 18 to 34 years old, and 5% of participants were 55 to 74 years old. Okay, this bar graph shows some of the findings, and it was created to compare the mental health symptoms before and during COVID-19. Additionally, a PRT test was conducted to determine the relationship between mental health symptoms before and during COVID-19. As we can see, the number of people affected by anxiety increased almost double during COVID in comparison to prior to COVID. We believe that sleeping habits also create an impact on people's mental health. So the most participants have demonstrated a negative change during the pandemic on their sleeping habits. Results show that there was an average of 4.01 of good sleep prior to COVID-19, in which, according to the participants, the good sleep habits average decreased to 3.66 during pandemic. And the question was based on a scale from bad to excellent, bad sleep to excellent sleep, 1 being bad and 5 being excellent. Even though participants show the discomfort and all the disorders that they experienced during the COVID, we found that less people are seeking medical help due to the mental health related disorders. So we can see a decrease of almost 5% of people looking for medical help. Probably this is due to the restrictions or probably for fear. Something that we want to add is that the Center for Addictions and Mental Health also found that there is an increase of 59.3% on people experiencing anxiety during COVID, but only 35% were seeking medical help for anxiety, and that only, according to their survey, only 16.5% would take medication for anxiety. Another interesting finding resulted from the last question of the survey. This was the only qualitative question, and the participants found an opportunity to share comments about their feelings related to mental health during the pandemic. Out of the 81 participants, only 21 answered this question, and there were 19 negative descriptions and 2 positive descriptions. There were even 2 suicidal thoughts on the descriptions. So some of the conclusions of the findings were that there were many emotional responses during COVID, and these include anxiety, stress, sadness, and depression, and they have incremented over 20%. But less people are seeking for medical help, probably due to restrictions or fear. Other factors that influence on emotional responses are sleep habits, or family relationships, or even isolation that create a significant impact on mental health.
So, why is the research important? The research is suggesting that there's a relationship between COVID-19 experiences and mental health status. There are variables associated with the COVID-19 pandemic that are playing a role in increasing mental health symptoms in individuals. Variables such as relationships, isolation, employment status, health status have been drastically changed for some people since the onset of COVID, and so this research is important to understanding how these social changes are affecting our mental health and the healthcare system. Increased mental health issues and corresponding prescribed drug intake has implications for Canadians' health, healthcare services, policy decisions, and the economy. So the research is saying that mental health symptoms have increased since the onset of the pandemic, likely due to the primary health concerns of COVID-19, which are adding fear, anxiety, and stress to people's lives, as well as the added restrictions that are limiting social contact and interactions with other people, affecting sleeping habits, relationships, and activities that were otherwise normal. These increases in mental health issues will likely lead to a rise in central nervous system prescribed medication used to treat these mental health issues. There are limitations to this study. The sample population is not representative of the entire population. The survey was limited to colleagues, family, and friends of the researchers, and so does not provide the diversity that we would see in the Canadian population. Additionally, our sample size was only 81 participants, so a larger sample size would also allow for better and more diverse data. The other limitation is from our data collection, drawing conclusions about linking mental health status and COVID, as well as the increased use of prescribed medication in COVID. We would need more data and analysis to determine if the restrictions are the cause of these increases. Here's some of the other research that is happening on this topic. Express Scripts Canada found that there was a surge of antidepressant use from 2019 to 2020. A study done in China on the psychiatric consequences of COVID-19 found that 16.5% of participants illustrated moderate to severe depressive symptoms, 28.8% of participants demonstrated moderate to severe anxiety symptoms, and 8.1% illustrated moderate to severe stress levels. The Centre for Addiction and Mental Health found that 50% of Canadians reported worsening mental health since the pandemic began, and substance use was on the rise in Canada during COVID-19 due to social distancing and self-isolation. The University of British Columbia and the Canadian Mental Health Association on the impacts of COVID-19 identified an increased prescription medication use of 18% in those with pre-existing mental health conditions. These studies and many others are showing the toll that COVID-19 is taking on the mental health of Canadians. Why is this topic important? With continued lockdown and restrictions, the number of people suffering or requiring assistance will likely increase. The research points to the need for enhanced strategies and programs for mental health. And what does this mean for the Canadian government? The increased numbers of mental health symptoms, illnesses, and prescribed medication used during COVID will add to the strain on healthcare services. Mental health illness may also affect people's ability to work, take care of family, and manage other day-to-day tasks, which in turn has a negative effect on communities' social and economic well-being. Policymakers need to consider this additional health crisis when making decisions. While managing COVID-19 is a primary focus, putting measures in place to ensure outreach and support for mental health is accessible and available should also be prioritized. Based on the findings from the research, policymakers must consider the effects that COVID-19 is having on mental health status and Canadians. With this, we have provided some recommendations. 1. Continued support for financial assistance and tax benefits. Improved outreach and accessibility to health practitioners. Improved mental health benefits to cover increased medical costs. Promotion of online, virtual, and telephone-based mental health supports. And educational campaigns to improve mental health through lifestyle changes during COVID-19, including consequences of substance abuse, improving sleeping habits, exercising benefits, and healthier eating recommendations.